Okay, I think we're live now. Welcome everyone to our LinkedIn Live. We're going to be talking about nursing and pharmacy and what these two professions actually have in common. So, for those of you that don't know me, my name is Sara Fung. I'm a registered nurse. I'm a healthcare advocate and entrepreneur. I'm also the CEO of the RN Resume. I've been a nurse for coming up on 16 years now, so I've done all kinds of roles, at the bedside, in leadership, advocacy, and now entrepreneurship. And I'm going to let my co-host, actually introduce himself to you guys.
Hi, I'm Stan. I go by Pharmacy Stan on social media. I've got 20 years of experience as a pharmacy operations expert, and I'm now a consultant for independent pharmacies. I started as a pharmacy technician when I was 16 years old and went up the ranks in the pharmacy to up to store manager, up to middle management, then into the independent pharmacy world, managing a few stores, and then hit burnout in the pandemic and decided to switch up what I was doing and find a different way to work on pharmacy, but not in the pharmacy.
Awesome. And I think we've kind of crossed paths a bit on LinkedIn. So we've been following each other for a while. And some of the posts that you make are about burnout. And I thought, this is really similar to what nurses are going through. And to be fair, I don't know too many pharmacists. So I thought this would be a good chance to talk about things like traditional and non-traditional roles for both nursing and pharmacy and just kind of have a little fun with it. And I'm going to try and monitor the comments, but Stanley, if you could help me with this as well, just to see if anyone is posting anything that we can address, that would be awesome.
Sure.
And for anyone listening, you can definitely put your comments in the chat. We want to hear from you. We want to know what you think, whether you're in nursing or pharmacy or maybe some other profession entirely. We just want this to be an open conversation. So I'm going to attempt to share my screen, and let me see if I can do this here. Share screen. So while I'm doing that, maybe Stanley, you could tell me what you think when you think of the word nurse. Like, what are some typical jobs that nurses have, just off the top of your head?
Because I'm biased working in the industry, like I understand nurses are, an essential part of the care team to the doctor and the patient, just like the pharmacist is, in my mind, always the third piece that's missing in like the perfect patient relationship triangle.
So when you think of nurses, do you think hospital, or do you think like what are they wearing? What are they doing in your mind?
Okay, yeah, I would think of hospital, wearing scrubs, again, assisting in operations, clinical tasks, charting. I don't know, everything that I see on Grey's Anatomy.
Yeah, I thought I'd put up this picture because it's kind of funny, because this is exactly what most people think, right? So we work at hospitals, we wear the white gowns and the caps, and there's all these stereotypes. So we're handmaidens, right? We're assistants to doctors, or there's like the slutty nurse that people dress up for as Halloween, or there's the nurse ratchet, or like those types of stereotypes. And I actually tried about a year ago to start making a document of all the different types of jobs nurses can have, and I've had to put it aside probably 3 or 4 times because there's just so many that I started getting overwhelmed. But just to give you guys an idea, there are of course many, many roles for nurses outside of hospitals, from public health to legal nurse consulting to forensic nursing to you name it, like nurse writers. There are nurses like myself who help you with your careers. You could be teaching in many different capacities. There are work from home jobs for nurses. Like, I think the list goes on. And it's just because I think that a lot of nurses are not out in the media. They're not out there putting out, what it is that they do, that people kind of just start telling our narrative for us because we're not there doing it. And a lot of it is exactly what you said, what you see on Grey's Anatomy. So the nurse is the one that's sleeping with a doctor, or they're never the central character, they're always the supporting character. So I think that is part of the issue. But just getting back to this infographic. I like this because, there's this perception that nurses make a ton of money, which may be true for some professions, like if you're a travel nurse, but it's not always the case. And there's this perception as well that nurses can get a job anywhere, anytime, which is also not true because there are certain areas that nobody wants to work and there are areas that everybody wants to work. So whether or not nurses can land a job that they are really happy with is a different story.
That's like literally every word that you spoke now applies in the pharmacy profession as well, especially to pharmacists. Pharmacy technicians have a different struggle that we'll talk about later. But yeah, word for
Absolutely.
word, pharmacist to nurse sounds identical.
Okay, and then before I share the slide then about pharmacy, my limited experience with pharmacists has been really limited to drugstores when I go to pick up a medication or drop off a medication. And when I did work in the hospital, I had some interaction with hospital pharmacists, but I would say not too often. And a lot of times it was just around medication reconciliation and the fact that we didn't complete those forms. Why didn't you complete these forms? I need to know what medications they're on. So that's kind of my experience with that. And then this fun little graphic I found on pharmacists. So what everyone thinks you do, what society thinks you do, what the media thinks you do, what doctors think you do, which is try to read their handwriting, what you think you do, and then what you actually do. Um, I'm just going to put this comment up real quick. So there's a comment from Cheryl that says, sadly, we also have stereotypes of Nurse Ratchet now that gives nurses a very bad rep. I totally agree. So just going back to pharmacy, Stanley, maybe you could talk about some common and not so common roles that pharmacists can hold.
So, common roles would be, your typical dispensing role in either a pharmacy, hospital system, healthcare system, maybe even some of the like newer digital delivery startups such as like Capsule and Medley, although Medley just went defunct this year. Those are what most people think of with pharmacists. Other roles, a lot of pharmacists can also work in like the medical writing profession, do research for big pharma, do research for independent studies or journalism. Um, Even less traditional roles, there's a lot of consulting in every niche of pharmacy has sprung up because of the pandemic. And there's currently the narrative that there's a shortage of pharmacists, just like there is with nurses and doctors and whatnot. At least on the pharmacy side, we're not sure that it's true. It seems more self-inflicted by the corporations that employ the majority of the profession. Anyways, but there are plenty of pharmacists out there doing other non-traditional roles that, like you said, I've heard of pharmacists that really excel in project and program management as well in the pharmacy. When you think of what you mentioned with medication reconciliation, that would be one program to operate. So somebody could, drive my favorite personally is medication synchronization, which is tied to medication therapy management. It's great for the pharmacy, the patient, the doctor. It just really improves the experience for everybody. So that's one thing. You could talk about inventory as another program, running, different clinical evaluations, immunizations. So in the pharmacy, the pharmacy manager does oversee so many different things at one time that they have a lot of soft transferable skills. There's actually quite a few people on the Business of Pharmacy podcast that have actually talked about other non-traditional roles.
That's amazing. And I know that entrepreneurship is another avenue you could go down as well. And you being one of them, it's definitely something that we need more awareness of. And I think just even more exposure to the transferable skills, like you said, that pharmacies have or pharmacists have.
Absolutely. Especially when you mention entrepreneurship, it's always baffling if there's not a heavy presence of clinical team present in your startup, team, having the knowledge of how to actually execute everything, knowing who the patient has to deal with in the healthcare system when they're going to have to talk to this person or that person. It's really hard for outsiders to solve our problems efficiently.
Yeah, I feel the same way about nursing because I was actually on another podcast where we talked about having one central chart, like a electronic chart that follows the patient everywhere they go. And in Ontario, where I am, they spent millions and millions of dollars trying to create this portable electronic medical record that would follow the patient, which ended up failing. And ultimately, what they said was it didn't involve frontline early enough in the process, and there was no buy-in. And so once it was ready to be rolled out, everyone said, "This is not functional. This isn't what we're looking for, and we're not going to use it." And it failed because of that. So if we can just always involve the people that are actually going to use whatever this is from the beginning and not just give them a seat, but give them a voice, I think that's really important and something that often gets overlooked.
Yeah, I agree. And it's really a shame because what you talk about, that idea is, a common idea for people who want to make improvements to healthcare. But when you have examples of failed change from outsiders, it prevents future investors from really taking, later entrepreneurs serious, or saying, oh, that's been tried and done before, but it didn't work.
For sure. And we have a comment again from Cheryl who says, I've worked with pharmacists. It's interesting how in the States, pharmacists need a doctorate degree, whereas here in Canada, they don't. Stan, would you be able to comment on that part, at least for the US?
Sure. Yeah. At one point there was a degree in the States that you could get that was just the RPH designation, or retail pharmacist, which was a 4 or 5 year degree. Don't quote me on that. It's been a long time. But maybe about sometime in the 2000s, almost every program changed to where it was became what's called a PharmD, or a doctorate of pharmacy, which became a 6-year program if you did it straight from high school graduation to finish, or an 8-year program if you did it, your 4-year degree first and then a 4-year degree after. There were some accelerated options, or there are some accelerated options, but yes, everybody getting licensed in the States is now a doctorate of pharmacy.
Okay, so just so I understand, what would be the minimum requirements then for someone to be a pharmacist in the US?
It's a 6 to 8 year program.
Okay. Okay, because to my understanding in Canada, you have to have an undergraduate degree, most likely in science or health science. And then from there, you go to pharmacy school. So it's another few years, I guess. So I'm thinking it's almost the same, but I don't know about the actual designation being a doctorate. Um, and this is my learning as well, so I'm not totally familiar with it. And if anyone listening wants to comment on it, I think there are slight differences between Canada and the US as well.
Yeah, it is a 6. Like I said, if you do all the prereqs and basically follow a predetermined course, knowing that you want to be a pharmacist straight out of high school, you can do it in 6 years, but otherwise it would be an 8-year program. First doing an undergrad degree, like you said, likely in science or math, and then doing your 4 years of pharmacy school plus rotations. And
Hmm.
now pharmacy has expanded with a lot of new clinical practice areas, and now residency in the state is common, where there's another 1 or 2 years that most students are going on to do.
Okay. And so let's talk about the pandemic now and how this has changed the pharmacy landscape and nursing landscape. I imagine there are some similarities, but what have you noticed with pharmacy in particular since the pandemic started?
Uh, the primary thing is burnout. There's a burnout in the chain and retail pharmacies in America because of the systems in place that create difficult working situations where patient safety is jeopardized. And then on the independent side, there's pressures from the PBMs, who are the same people who are associated with, or related to the people who also run the chain pharmacies in America. So it's usually the same entities that are creating pressure both on their own employees and the private industry through different fees and clawbacks that make it hard for them to stay profitable. And then there's, on the independent side of the business, there's a shortage of pharmacy technicians, which were always considered an entry level position for the longest time. But it's not quite an entry level job. It's, it requires a lot of demanding skills, and, it's not quite different at the retail level than being a pharmacist, aside from having the clinical knowledge of the drug interactions, but the rest of the tasks are the same. So now that in America, a lot of like big box corporations have increased their starting wages, it's dramatically competed with the talent pool who might go into the pharmacy so that they don't feel like they have to work in retail or something, making it even more difficult to find that position, because the pharmacies then haven't raised their wages to match the rest of the other entry-level positions in the country.
Yeah, it sounds like there's a lot of similarities with nursing as well, because I mean, every issue I'm going to mention was present before the pandemic, but I think the pandemic just made them worse, or it made people more aware of them. So the burnout for sure is one. Being short staffed is another. Nurses feeling like they have no say in anything, not being involved is a third. There was a lot of issues at the very beginning of the pandemic around paid sick days. So, in a lot of cases, at least where I am, if you are sick, you are not compensated for your time. And so, when people are forced to choose between, making their paycheck and being able to pay their bills, or doing what is the right thing and not going into work sick, it just creates this dilemma. And I think also, at least where I am, pay was an issue. So there was a lot of talk about pandemic pay that didn't come. We were able to negotiate less than 1%. That's since been overturned, but it just left a sour taste in a lot of people's mouths, that we were being called heroes, but we weren't being treated that way. And we were being told that, we save lives, we love nurses, but then where's the love when it comes to actually being paid what we're worth and being treated with respect? And one more thing I wanted to bring up is that there's actually a lot of violence in nursing. I mean, violence from patients and families directed towards nurses, whether it's verbal or physical. So I don't know if pharmacies or pharmacists experience any of that, but it definitely is something that public is not aware of.
Very, very much so. I've had patients threaten to report pharmacists to every board they can, or threaten to have their license revoked over, somebody not getting their statin on time because the patient didn't want to come downstairs from the building in Manhattan.
Okay. Yeah, that's really unfortunate. And so when you're saying that there's not a pharmacist shortage, I'm thinking this means there just aren't roles that pharmacists want to work in. So from your experience, where are they going, or where have they gone to?
I, so I think a lot of pharmacists have left the profession and started doing other things. The one, like, truth be told of pharmacy is it is a very consistent, decent living in America. The average pharmacist makes at least $120,000 a year. So as people were becoming less and less happy, I think they took that, whatever surplus income they had, disposable income they had, and then started side hustles and started just exiting the profession. Maybe keeping their licenses active, and they're picking up as, like, floating pharmacists here and there if they need money.
Hmm.
I just think because the major players in the industry have soured their reputations, for decades, which, I've worked for one of them for 15 years. I can confirm the, decline in the workplace. So at one point we read magazines by 7 p.m. when I was 16 and just starting out, doing the same amount of prescriptions as, in 2017 when I left left that company.
Hmm.
And usually the pharmacist was leaving, 20 to 30 or even maybe 100 prescriptions unfinished before the next day because they didn't have enough time to get everything done, as corporate had instilled different policies and procedures or metrics that had to be achieved that were more important than actually patient care.
Right, right. And I feel like this is something that just keeps happening. So a lot of organizations talk about patient care being the pillar of their organization, but it just seems like the incentives don't really speak to that. So I mean, you might get a pat on the back for doing a good job with your patients, but I think that's the end of it, at least for nurses. So there is no real incentive. The incentive for nurses in Canada, where I am, is just seniority. So if you stay at a certain organization for a period of years, you move up the pay grid and you get your rewards in seniority, which might be better shifts or better vacation, better pay, of course. But there's no real incentive to do what we should be doing, which is provide the best patient care we can. And especially with the patient ratios being as high as they are in some organizations, there's no way that you can provide good patient care when you've got 10 or even 15 patients. You're just doing the bare minimum. And part of it might be just giving out the medications on time. But not being able to do anything else. And that's the moral distress that a lot of nurses feel, is that they've been trained to provide a certain level of care, and knowing that they physically can't day after day after day is just really, really hard on them. And the fact that there doesn't seem to be any real improvement after all this time is doubly frustrating.
They're same that again, those sentiment mirrored in the pharmacy industry. I'm not sure if you came across in your LinkedIn journeys the movement or hashtag pizza is not working that Bled to Know is leading, and now the documentary that do you want shots with that?
Mm-hmm. I mean,
Um,
it's just like, I mean, Nurses Week is coming up in May. And based on what I saw last year, I cannot believe what some organizations think is appreciation for nurses. So the pizza is one thing, or saying, "Oh, you're a lifesaver," and then literally giving them like lifesaver candies as though they're children. I just, I almost feel like not doing anything is better than doing that.
I saw a CVS that set up a whole display to say thank you to their employees, but said don't eat anything because everything had to go back on the shelf.
Or I've heard of some nurses saying that their organization organized a lunch for them, but they still had to buy tickets to their own Nurses Week lunch. So it wasn't free even. Nothing was free. There's another comment here I just wanted to bring up. So Cheryl just wanted to know, could we address the current train of thought around burnout or violence in the field? She has 20 years of healthcare experience, from staff nurse to leadership to director of care, and now as consultant. She's noticed that new nursing graduates don't really know much about the side effects of drugs and when prescriptions are made for outpatients. Sorry, it cut off. I'm not sure what the rest of it said. Um, I guess to answer your question, I think that there honestly is so much that needs to be covered in nursing school that I think it just gets pushed to the side. And especially with what happened in the last few years, a lot of nurses didn't get in-person placements. They got virtual placements. So how can you really learn about the side effects in a real patient when you're just learning out of a textbook? Um, I guess that would be my 2 cents. I don't know, Stan, if you have had any interaction with nurses, or it's mainly been, pharmacy at the retail level. Any thoughts about this question? Okay, I don't know, Stanley, if you froze or not. I can't really see anything on my end. Okay, I lost Stan. Okay, I'm just gonna keep going. So, just putting up Cheryl's question again. So the rest of it was that the main crux of the question is, she added above, which is, it's the pharmacist's role to educate about side effects, but hope nurses never forget what they should know, at least the basis of what they're giving and its effects. I totally agree. I also noticed that patients do not always provide side effects information as well. Is there an unspoken rule that education about drugs? So I think that I mean, at least for nursing, we have all the resources at our fingertips, whether you work in a hospital, whether you work in home care, about medications and their side effects. And certainly we should be providing the information to our patients. I think going back to what the issue is around patient ratios is that even though the nurses have the resources at their fingertips, there's just so little time to do what we need to do that it becomes like this rotating sort of conveyor belt of just getting the medications out and, okay, I'm going to give this medication because it's due now. I'll come back later to talk to you about what the side effects are. And then some other issue happens that's super pressing, and then maybe that just falls by the wayside, unfortunately. So I do think that is part of the issue. One second, just gonna see where Stanley got to. Stanley's having internet issues. So I'll just keep going and talk a little bit more about really. So we talked a lot about the issues. I think it's pretty clear to most of us what the issues are. Um, and maybe we can talk then about what can be done about this. So I think the first thing is that we really need to look at what California and now BC and Canada has already done, which is implementing legislation around safe patient ratios. I think that is a huge step in the right direction. When I heard about this in California, that they actually follow the legislated patient ratios, I was actually really surprised because I thought it was something that nurses, knew was legislated but didn't actually happen in real practice. So I did post a question on social media a while ago asking for those nurses in California, do they actually follow the legislated patient ratios? And everybody pretty much said yes. And then, of course, the question comes, well, what happens when there's a shortage? Because that is everyone's second question. Um, and from what I understand, it's really just about the organization taking the onus of making sure that appropriate staffing occurs, whether that means using agency nurses, whether it means hiring more nurses, whether it means finding more appropriate patients or appropriate places for the patients to go. So I think that's another issue or solution that we can think about. And I also think that it's really important for us in healthcare to be vocal, continue to be vocal about what the issues are, continue speaking up, whether it be on social media, whether it be writing a letter to your politician, using any means possible to let the public know that we are in very unsafe conditions all the time. And really, in healthcare, it's only a matter of time before something happens. Um, Cheryl says these issues are systemic in nature and need to be addressed not only from root cause analysis, but proactively as well. So I totally agree. And I was actually having another conversation with someone else who said that we need to be more creative with nursing school because not only is there a shortage of nurses, but there is a shortage of placements for nurses in nursing school because there aren't enough clinical placements. There aren't enough instructors. And so being more flexible and creative with how we train nurses is going to be really important. So welcome back, Stan. I saw that you were
Sorry,
having some internet issues, but you found your way back.
my apologies. Yeah, it's weird working from a laptop.
That's okay. So I just started talking about what some of the solutions could be because we obviously know what the problems are, and for nursing, I just said being more vocal about what the concerns are and being active on social media, writing to your politician, letting the public know what some of the issues are that we see. That as healthcare workers, we always try to work around as best we can so that we can still provide that level of care. But at some point, there's only so much more you can do as a single person.
Yeah, I agree. I know in pharmacy, one of the issues, or like, something that people can do, but where we lack is joining our state and national associations to get a seat at the table. We have a lot of chain pharmacists who are unhappy with the way that the conditions are, but almost none of them serve positions on the board or even, members of the associations in their state. So they're never going to get a say to make any changes. And in any change, it takes a lot at least in America, it takes, multiple states trying to enact the same policies to essentially make nationwide change. As we finally started to see some nationwide PBM coverage, which is the pharmacy benefit managers and their unfair business practices that they impose on independent pharmacy and other people in the supply chain. It took numerous states starting to investigate their business practices to get national attention. So if we don't do it on a state level and talk about our working conditions being horrendous and patient safety being at risk, I recently saw that the people at the meetings, the people with the seat at the table, who are directors of relationships or directors of relations at the big chains, are saying that the reason their pharmacies aren't able to perform is because of too much regulation. So if we don't work to fix the problem, they're just going to seek to make the problem even less controllable because of their own doings.
Mm-hmm. And I just have a random question. So, regarding licensure in the states, are you able to move from one state to another, or do you have to apply for a new state license?
In pharmacy, you need a license in any state that you want to practice in.
Mm-hmm.
Or even if you're an independent pharmacy, you need to have a out-of-state license to dispense to patients in those states if you want to mail or ship or somehow deliver.
And is that process, does it usually take a long time to get licensed in another state?
For the pharmacists, yes, I've heard I've heard multiple complaints about it, and there has been talks about having a national licensure, not licensure,
Mm-hmm.
but it's not my area of expertise,
Mm-hmm.
so I'm not familiar with if that has any traction, if that's actually a good idea.
Yeah, and for sure, this is something that has been talked about in Canada for a while. Some people love the idea. Some people think that we're just short everywhere, and so you just be taking nurses from one place and moving them to another. So I think those are some of the questions that I had for Stan. I see that he's dropped off again. And so, with that in mind, I think we'll just end this LinkedIn Live for now. If anybody is looking to get a hold of me, you can certainly add me on LinkedIn, send me a DM. You can reach me at thernresume.com. You can also find me on all the social media platforms. So, Facebook, Twitter, Instagram, YouTube, TikTok, you can find me there. And especially if you want to reach out to Stan, you can also add him on LinkedIn or send him a message. I'm sure he'd be happy to hear from you. And thank you, everyone, for joining us on LinkedIn, and hope to see you again soon.